You heart healthy. It is Rally for Red Day here at ABC 15, and as always, we partner with Mayo Clinic to bring you the latest in heart health. And today, we're focusing on athletes and couch potatoes, actually. It's kind of a combination. We're going to explain that in just a moment. But actually, how performance-enhancing drugs can actually defeat the purpose. Dr. Komandor Srivatsan, help me. Srivatsan. I apologize, doctor. Thank you. He's with Mayo Clinic. He's a cardiologist here to explain the issues. And I am fascinated by what you're going to explain to us today, doctor, because what happens is you're saying that it doesn't matter if you're a couch potato or a high-performance athlete, that the exertion level between those two can be really, really dangerous. And we're talking about arterial fibrillation, or Afib as it's called. What exactly is Afib to begin with?
Atrial fibrillation is irregular heartbeats. Generally, people feel it as palpitations, lightheadedness, dizziness. Rarely people can actually faint from these. And generally, it is considered a disease of people older than 60 to 65 years. It is a major risk factor for stroke in that population and sometimes heart failure.
Wow.
But it is reported in young people, and we will talk about it as soon as we know a little bit about athletic performance and atrial fibrillation.
So you have a graph that really kind of explains it very clearly, that says the exertion level, that's really the problem.
Yes.
Correct?
So if you look at the graph, at a very beginning, the people who are low intensity or no exercise seem to have atrial fibrillation or irregular heartbeats, which they feel as palpitations. They start doing some mild to moderate exercise, the curve actually comes down. But look at the high performance athletes like the basketball players, football players, and Olympic endurance athletes, triathletes. The incidence of atrial fibrillation starts increasing, going even up to 5-fold higher than normal population.
Wow.
So the excess exercise increases the amount of blood return to the heart, stretching the muscle fibers up to 5 times the cardiac output that they generate because of the intensity of the exercise.
Right.
That leads to certain damages, which eventually leads to atrial fibrillation.
And if you are consider yourself a high-performance athlete, a lot of athletes will turn to performance-enhancing drugs. What are some of those drugs listed that can actually damage your heart?
Absolutely. That's a very good question. Anabolic steroids are very common among endurance or are not uncommon. Stimulants, amphetamine. Of course, the illegal drugs, cocaine and ecstasy, but in boxing, particularly diuretics are used to bring the weight down just before the match.
Really?
Or erythropoietin, which is a way to increase your hemoglobin content. These are some of the drugs. Of course, these are available, but very few athletes use them. But if you use them, the risk of atrial fibrillation quite significantly increases.
So what is the treatment process then for if you are diagnosed with Afib? How is it curable?
It is curable. One such thing is being shown on your monitor right now. So that is a catheter which is 1/10 of an inch, which goes through the groin from the blue side of the heart to the red side of the heart across the septum. And that yellow flickering area is the abnormal rhythm area. And we try to cauterize around the mouth of the vein to contain this irregular heartbeat within this area. Now, why is this much more useful for athletes is the athletes will not take medications regularly. It may reduce their peak performance, and so they may look for much more of a curative solution rather than trying to take medications. Of course, we usually try medications, which is when they take as a pill in the pocket approach just before peak exercise.
Sure.
But in some of the sports, medications are banned, and they look for alternative therapies such as ablation to cure the problem.
Yeah, wow, it's really fascinating, and I appreciate you coming in today, because I really had no idea actually even how dangerous it actually is. So thank you very much, doctor, and I want to let everybody at home know that you can make an appointment for an evaluation with a Mayo Clinic cardiologist. Learn more, stay heart healthy, 480-301-8200. And please don't forget that ABC 15 teams up with our Rally for Red campaign. Each month, we'll give you easy-to-follow recipes and ideas to help keep you and your loved ones heart healthy. To learn more and get your Rally for Red reminders, just sign up at abc15.com/rallyforred.